Hi, this is Marie Truth, family physician, and this is today's consultation. Today I'm going to talk about the URI, the upper respiratory tract infection. Everyone's had this experience. You're going through life, minding your own business, and then you feel this little scratchiness in your throat. Then that scratchiness might turn to a little pain, and then suddenly you've got a little bit of a stuffy nose or a runny nose, and then you might end up developing a cough. Well, this sort of describes how viruses act when they infect you and cause upper respiratory tract infection. The virus is good at attaching to the lining of your throat. It replicates, it causes swelling and mucus production. Then it tends to move up to the nose, doing the same thing, then down into the airways. When it makes that mucus tends to come out yellow or green. And we all kind of know that because we know that boogers turn yellow and green when they sit in our noses. So the color of the mucus isn't consequential to whether or not it's infected with bacteria or virus. When that virus finds its way up to the nose, it's going to cause some stuffiness and inflammation. When there's inflammation of the nose, we call that rhinitis. Up in the sinuses, that's called sinusitis. And down into the airways, that's called bronchitis and pharyngitis. So thinking up on the nose, in the sinuses for a second, let's say you're blowing out a lot of snot and that snot seems yellow or green. Well, you might think that, well, that means I need to go get to the doctor's office and get my antibiotic. But our infectious disease colleagues ask us to wait for 2 weeks prior to using antibiotics for those types of symptoms. The reason is that it's the inflammatory response to the virus. And by prescribing antibiotics, we're actually causing resistance in bacteria. Down into the airways, let's think about that for a second. Those airways are like straws, and they also are lined with a delicate lining like that of your nose. When the virus infects that delicate lining, it swells and it creates mucus production. That makes the lining more narrow. When you cough, you might get a rattling sensation. Well, that's air being forced across pooled mucus in your airways. During the day, that mucus is pulled down through gravity and you cough it up. At night, it layers out, and that's what causes that cough at bedtime and sometimes a worsening cough at bedtime. If that narrow airway had air forced through it, it might make a whistling sound, and that's what wheezing is. So if you feel like you're wheezing, again, that might be related to a virus. So when do you need to go see your doctor? Well, if you just have a cold, sore throat, runny nose, and cough, don't have a fever, and you feel well enough to go to work, antibiotics aren't going to change the course of the illness. But if you're feeling short of breath, have prolonged fever, get winded when you're just doing regular activity, can't swallow at all, have a severe headache, can't breathe through your nose, you need a note for work, these are reasons to go see your family doctor. So again, the URI is caused by a virus. It causes inflammation in the nose, the sinus, the throat, and the airways. Antibiotics don't change the course of a cold. You need to have the symptoms for at least 2 weeks before an antibiotic should be considered. This is Marie Truth with some truth about the URI, and this is today's consultation.